On this episode of the Athletic Potential Podcast, we're going to talk about how to get rid of a kinked neck. We're also going to talk about how to perform distance-based off-season throwing programs in the cold, as well as whether we like free weight versus band arm care routines. Welcome to the Athletic Potential Podcast, your place to come and get answers to your athletic development questions. We cover a range of topics, all related to helping you to achieve your athletic goals so that you can experience and enjoy the athletic career that you deserve. I am your host, Dr. Mike Matthews. Hey everybody, welcome back to the Athletic Potential Podcast. And today we are going to be talking about a couple things, cases that have come up more recently, and I seem to be discussing quite a bit more recently, with the first being kinked necks. I've had multiple patients come in, both athletes and non-athletes, talking about how the fact that they woke up one morning, they couldn't turn their head, and it was quite painful. We're talking about how to manage these things as they seem to happen to not only the athletic population, but also the general population. And then we're going to take some question and answers. We're going to take some questions from our audience and give some good answers in regards to a couple different things. And so we're gonna jump right in as a quick introduction. My name is Mike Matthews. I am the owner and operator of Athletic Potential. I'm a physical therapist and strength coach. And on this podcast, we try to give answers out to the many of the questions that we get to allow people to make good decisions in regards to advancing their athletic potential. So let's get right into it. So we're going to talk about kinked necks. This will be a little bit more general than we've talked about in the past. Usually have maybe a case specific person to talk about, but realistically in this case, we're going to talk about a general kinked neck. And let's classify that as you go to sleep, everything's fine. You wake up and you cannot turn your head left or right or in a specific direction, or your head's locked into a certain position. And a lot of times we'll get patients with these kind of things where they come in with their head tilted and they're kind of looking up and they're like, I can't move. This is all I've got. And it becomes very challenging as a clinician to try and figure out what to do. And what we're going to discuss is those kinked necks that are mechanical in nature. There are a few classifications of neck pain that are not mechanical in nature, and those don't quite apply to these things, but most of our kinked necks that we experience or see are going to be more mechanical than not. And so a lot of people will ask me, well, like, what is a kinked neck? What does it mean? I can tell you this, that majority of the time with kinked necks, two things are present. First, you have a very irritated joint in the neck. The way our spine's built is there's two joints, one on each side at each segment of the spine. And one or both of the joints can get irritated for whatever reason. Most people have had the experience of like jamming a finger or jamming a thumb, those type of things. And essentially what happens is one of those joints in your neck becomes jammed and it hurts to move. Now, the second thing that accompanies that jammed joint or that irritated joint is typically either a muscle spasm or significant muscle pain when trying to move out of positions. And those can be very challenging because once those muscles spasm and are protective of that joint, it is very difficult to get them to be not protective anymore. And so there are a few other things that I want to address as of right now in regards to kinked necks. If you are having symptoms, numbness, tingling, pain, weakness down the arm itself, so if you have pain in the neck, but then you notice like, hey, I can't grip as much, or a couple of my fingers are numb, those type of things, we're kind of out of the category of a traditional kinked neck at that point. We've got to worry about nerve sign and nerve problems, and that's a different case for another day, as it is a fairly complex treatment cycle to try and figure out what's going on, but then also treat it. So we are not talking about anything where the pain radiates down into the arm all the way to the hand. And so that is not today. What we're talking about is pain is directly in the neck and limits your ability to move to the point where it's almost painful to even move your eyes. And so we see two things, again, just to reiterate two things. One, we see a fairly irritated joint structure or both joints in the neck. And then we also see muscle spasms that come after that. And so we've seen this in a number of different athletes. It's been seen on the highest scales of athletics. There was a pitcher in about 3 or 4 years ago, I believe. That was scheduled to start Game 7 of the World Series, and they were worried that he wasn't going to be able to make the start because he woke up with a kinked neck. He couldn't move his neck, those type of things, and he ended up making the start and did really well. They ended up winning the World Series. But anyways, the idea here is we've got those two distinct things that are going on: irritated joint and a muscle spasm. And in order to treat this, we got to decrease the irritability and the pain in both. That is not an easy thing to do. Now, I'll tell you what would normally happen with our clients if they came into us, and maybe that will kind of help everybody. And what most people are going to do, and what I've seen home treatments look like, is they'll get this kinked neck, they won't be able to move, and they'll first either go straight to heat or straight to ice. And I can tell you right now, I tell everybody, you use whatever you think is the most effective. My first piece of advice has always been heat. I like the idea of heat. It decreases muscle tone typically. Cold can increase muscle tone to a certain extent. It can increase EMG activity. And I don't really want that in a muscle that's already maybe spasming. So I always say, let's start with heat. If you're going to try anything at home, you can use icy hots, Tiger Balms, Red Hots, Atomic Bombs, those kind of things to help decrease the muscle spasm. I'll be honest, some of those work and some of them do not. Now, when a patient comes into us, we see an obvious neck spasm. We try to identify the area. So let's just say it's towards the lower part of the neck. It's limiting them more in rotation than anything else. The first thing we're going to do is put electrical stimulation in the form of pads on that patient and put them on heat and lay them down. You want to minimize or get rid of gravity here as much as you possibly can, because gravity is what creates compression upon the irritated joint. Imagine you jammed a finger and you just keep jamming the finger. It doesn't feel good and it's not ever going to heal. As you're upright in an upright posture and you have an irritated spinal segment or spinal joint, it's going to continue to get irritated. So I tell everybody, look, we're going to lay you down. We're going to put electrical stim on you to help decrease pain. And then we're also going to use heat to decrease muscle tone and also to decrease pain. The hope is that when we do that, we see a decrease in muscle spasm, because remember, the muscle spasms are protective. They're trying to protect the joint that's in so much pain. And so we want to see a decrease in that. Now, the reason why we want to get rid of the muscle spasm, even though it is protecting the joint, is that when it fires and doesn't allow you to move, it actually creates compression. And that can create more pain in that spinal segment. So we have them lay down, we put electrical stim on them, we put a heat on them, we have them relax in a very gravity minimized position, usually just laying down, so head supported with a blanket or something like that. It's in a very comfortable position. Once we have had them in that position anywhere from 5 to 10 minutes and they feel like their pain levels are down, we will now assess to see if we can find what level of the spine that pain is at. And then we will typically find it at that point, because the muscles won't be quite on spasm as they used to be. Once we have figured out what level that irritation is, then what we'll start doing is general traction. So just kind of think, if you got a jam joint, it doesn't feel good to do this in the finger, but it does a little bit in the neck, is you just pull that joint apart. You're trying to decrease the compression. You pull just enough to create relief, and we hold for anywhere from 10 to 15 seconds, and we do it as many times as we needed until that patient feels like they are feeling pretty complete relief. Now, we immediately test this by sitting the patient back up. Now, gravity's fed back into the equation, and if they immediately go back into neck spasm, by the way, when we sit them back up, we physically help them sit back up, and I control their head and neck. So I control their head and neck all the way up so they don't fire the muscles that are usually on spasm. We have them sit, and if their spasm doesn't come back and their pain levels are low, then we know we got the right area. Now, I don't have them do anything after that. I have them lay back down. We found the right area. We figured out what was going on and what level it was. Now we lay them back down. And at this point, usually at this point, we kind of know what muscles are causing the spasm. And this is where I typically will come in and do two different things. First, I'll do what's called positional release. I'll put them in a certain position, have them just lightly flex against me, and then relax, flex and relax, flex and relax. And what happens is that gradually decreases the tone of the muscle. Now, once that has happened, if they are still having more pain or they feel like the muscle is firing, we will then go to a dry needling technique into the muscles themselves. Now, this can get really tricky. We've definitely had this where we've put needles in and the muscle spasmed again. And so we're very cautious on what position we put the needles in, as well as making sure that we are going slow and going essentially 1 to 2, 3 needles at most to try and make sure that the muscle doesn't spasm. And if it does, that we can try and slowly, extricate the needles out. And so we typically do that. And now what happens is normally the patient will come in at about a 6, 7 on a 10 scale of pain, unable to move their head and neck. My goal is to get them to be able to sit or stand without any head and neck movement, with no muscle spasm, and a pain level of less than 2, preferably 0. And a lot of times that does happen. Now what happens, as soon as they're able to do that and get up and walk around and their pain levels are low, I will tell them as much as they possibly can not to try and turn their head, no crazy quick movements, those type of things. That they need to do is start turning muscles back on around the neck very lightly in a very isometric type way. This looks very easy. I prefer one exercise. I don't like all this stuff where you push here and you push here and push here. The problem with those is that it's unregulated. You can't really do a good job, and it doesn't keep a lot of the time the spine in neutral. What I like, and for those that are watching, you're going to be able to see this. If you're not, just imagine as best you can. You're going to take 2 fists. You're going to put palms towards your neck. You're going to actually put them on your neck itself, directly under the chin, so that your knuckles are lining up with the front of your chin. What you're going to do is you're not going to push down with your chin. You're going to push up with your hands. So you're just going to push up with your hands. And when you do that, you'll feel all these muscles kind of in that front part of your neck flex. Now, here's the key. You got to be in good posture. So you got to be upright. Spine's got to be in neutral. Then you're going to go here and push. When I say push, it's like 5%. You are barely pushing. You only want to feel these muscles turn on but not spasm. They do that for 10 seconds, 4 rounds for 10 seconds. And then that's it. And then I tell them just to go, they're good for that day, and they need to go do that essentially maybe every hour on the hour. But when they go home, their first protocol is to find what I call a recovery or relief position, where if that muscle starts getting spasmy again or that neck starts hurting them, they're to lay back down, put it on heat, find that position of comfort, and then be able to go through that same protocol again where they have to just relax. Now that's day 1. Day 2, typically I tell them, now you're going to be laying down. You're going to now go roll your head side to side. If you can do that without neck spasm, you're looking fantastic. Then you're going to do that. So side to side laying down on day 2. At the end of day 2, you're going to get up and you're going to go side to side. Now, I know there's a lot of people going, wow, so it's going to be 2 days before I can turn my head side to side. And the answer is, if you have significant neck pain and you're spasming, you're going to be happy that you're moving and upright without a whole lot of pain. If you've ever had these are nasty, and they will not allow you to move, and you'll spend most of your time laying down. So if you can get to the point where you're upright on day 2 and turning your head left and right in gravity, you're doing really well. On day 3, we're doing the same program, fists underneath the chin, head left and right, and you kind of go back to normal activities of that day, pushing, carrying, pulling, but keeping everything in neutral of the spine and moving nice and gradually out from there. Now, if you're having residual pain in that joint continues to hurt, typically your next visit with us would be on day 3 or 4 to make sure that we decrease the irritability in the joint. We will do that same way we did before. Positional release. We'll actually use muscle energy techniques on day 4, and we'll also use dry needling to decrease that. What we found is it takes, on average, if we can get on this really soon, maybe takes about 4 to 5, 6 days to get the neck completely 100% back to normal, which is really nice. Now, the other thing I want to note is we do this typically. Some of my patients come and they've already got medications on board, but they typically do this in the absence of medications. So a lot of times, like, I need muscle relaxers to decrease this muscle spasm. The answer is yes, you can do that. But remember, part of the treatment is then making sure that all of the muscles are back on and stabilizing the spine in a position that doesn't hurt. If you're on muscle relaxers, it makes it more difficult to do that, in my opinion. So there you go on Kinked Necks. That is how we manage someone who has a very acute kinked neck, something that's just happened. Hopefully there's some pointers. Let's go over this again. It's an irritation to one of the joints in the neck, and typically you have muscle spasms that are associated with it because it's trying to protect the spine. First thing you're going to do is get gravity out of the equation by laying down, use heat, electrical stimulation if you have it, and then if you can, get to a clinician who can do some type of positional release techniques and dry needling. From there, you're going to start a slow activation protocol. That's that fists underneath the chin with light movements starting in laying down, then sitting, and then eventually doing your normal activities at that point. These things can be challenging to treat. The key is that you have a plan and you don't rush the plan and you don't go too slow either, because that can cause problems there too. Now, if you have a significant amount of pain, it's a lot of times really difficult. But I can tell you this, that the more you can stick to a similar plan of this, I think you're going to have more success. And there's a lot of different types of kinked necks. I mean, you can have multiple levels of problems. It gets fairly complex, but to keep it more simple, just for the sake of the podcast, this is how we would manage a more simple neck, kinked neck that comes into the clinic. And we've seen pretty good success with this. And I hope that helps anybody that has experienced these things, and maybe gives you a little bit of a framework and a guide or a plan to follow as you go through it. So, okay, so there's our case. We're going to now go ahead and switch over to questions. Our first question is a really good question, and it's something we get all the time, specifically in this time of year, and especially in our climate. So this question comes from Devin. Devin says, my son is currently on a ramp-up program. Hallelujah, Devin. I don't know if we gave it to you or not, but he's on a ramp-up program. This is good news. A lot of people don't ramp up before the spring. They just start throwing in the spring on the first game or practice. Anyway, sorry, rant. But here's the idea, Devin. My son is currently on a ramp-up program. We live in a very cold weather state where there's typically snow on the ground, and our ability to throw longer distances is very limited. We currently throw in a garage with a maximum distance or length of that garage of 70 feet. How would you suggest going to 120 feet and 150 feet that's suggested by the program when we only have 70 feet? Thanks for the help. Devin, this is something that we deal with all the time. So I work in a facility where our max distance of throwing that we have, if you were to play catch with someone, is right around 155 feet. Now, in order to do that in our facility, and I haven't measured out, so it actually may be more than that, but in order to do that, we would have to raise every cage that's in here. If we have cages down, I mean, we're talking at least 4 cages that we'd have to move and raise and roll them up and get them out of the way. So it's 100 and, we'd have to do that. That takes time and energy and effort and all those type of things. And it takes time away from people that maybe want to be in the cages. And so we don't typically have 155 feet. What we normally always have is about 105 feet. And I can tell you this, and this is what my answer would be to you for you, Devin. And I don't know how old your son is, but if he's supposed to be throwing 120 to 150 feet, he's probably a teenager, maybe 14, 15 and up. If younger than that or is skeletally immature, we don't need to go over 120 feet. 120 is kind of your max distance I would worry about. But even then, if you had 120 with a youth, you only have 70 feet. So we go with 105, but let's just change what I would do to 70 feet. Here's what we do with our guys that we have currently here now that are throwing. And just so you emphasize this is something that we use with our professionals. And so they're here, they have 105 feet to throw with. What we do is, depending on the day, we determine the day to either be a high intent day, a low intent day, or a moderate intent day. And intent just means how hard do they expect themselves to throw. Now, just so you know, when you use a distance-based program, the distance that's on the program is what's monitoring or managing the intensity of your program. So the idea is that you're going to have to throw harder to throw at 120 feet than if you were to throw 90 feet. And so what we're doing is saying, look, we're going to just be much more purposeful and intentful on our throwing programs, and we're just going to label the days out. And so what we're going to do is, I can tell you what one of our guys is doing right now. So Mondays are a moderate intent day. He usually goes out to about 90 feet, 95 feet. Tuesdays are a high intent day. So again, you maybe go out to 90 feet. Sometimes he only goes to 75 and just increases the intensity there. And then Wednesdays are a very low intent day. Thursdays are a moderate intent day, Fridays a high intensity day, and Saturdays are low intensity days. Sundays are typically off until we get a little bit closer to the professional season. Then we're going to crunch this down into a more of a 5-day rotation, which they may be more likely to be on. So to bring it all back, so on Monday, he kind of warms himself up nice and easy, arm loose and whippy, out to whatever distance he feels like he wants to go that day, typically around 75 to 90 feet. And he's on a moderate intensity. And so once he's at that distance, he'll give me a signal. I'll start a timer on my watch, and he has anywhere from 6 to 8 minutes. And in his case right now, we're at 7 minutes. So for the next 7 minutes, he's going to start increasing his intensity and then get to a level of intensity that we'll determine for you. And I'll show you how we do that. I'll tell you how we do that. He'll get to that level of intensity, and he'll stay at that level of intensity for the duration of that time period, 7 to 8 minutes. At which point, once he's done, he'll maybe bring it back in a little bit for a couple cool downs, but then he's done. And so what it looks like is we use a pocket radar, and I'm not partial. I don't get any money from pocket radar. It's just what I have. And we use a pocket radar to measure velocity. And depending on where he's at in the course of his throwing progression and the time of year and what we're trying to get him back to, he should be within a certain range of miles per hour in regards to his velocity. And we measure that based on his average velocity from the following year in pro ball. If you're talking about a youth athlete, what I would say is take whatever their peak velocity was from that year that you have measured, and I would just kind of base everything off of that. Whereas a moderate intent day, maybe about, 10, 12 miles an hour slower. I'm totally making this up, but just kind of off the top of my head for youth. High intensity day would be like 5 miles an hour slower, maybe getting to that peak. And then a low intent day would be, 15 to 20 miles an hour slower, just getting the arm moving. But just know that those increase as you get closer to spring season. We would expect those intensity levels to kind of bump up. And so instead of moderate would be 10 miles an hour slower than their peak from last year, it would be 5. And our high intent days would be at the peak from last year, because he's a youth. We kind of expect him to throw a little bit harder, right? So anyways, but to come back to it. So that's kind of how I would structure the off-season training or throwing program, and do that in the absence of distance. And so if you don't have a way to measure velocity, and you don't want to buy a pocket radar or any of these other radars that you have, you can go based on feel. Here's the main thing I want you to take away, Devin. There's 3 things that we build these programs on, and this distance program is also the same. Here's the 3 things, and I'm going to venture out to say that these are in order of importance based on what I think. First, it's feel. What is that athlete feeling? What does their arm feel like that day? If they have a high intent day and they're done and their arm doesn't feel good for that day, on an off-season throwing program, I just tell them, get what you need out of it and be done, right? And then I don't skip days. Like, that was a high intent day. Next day's low intent day, right? But the idea is feel is number 1. Number 2 is measures of intensity. So that in our case, that's miles per hour. So I would look at what's our measure of intensity. Okay. And then the third thing, the third factor that I would recommend is basically how far you can throw. So if you have the distance ability to do it, then you can. It's a pretty loose thing. It's not something that's set in stone, Devin. I'll be honest, we're working on it. If you ask me this question 6 months from now or next off season, I'll probably give you a different answer, and we'll have probably found a better way. We've got a lot of different experimenting going on right now that has proved to so far be pretty good. But like I said, this is our first, I wouldn't say it's our first time, but we're refining the process yet again this year. It seems to be working even better. And I think the key is just make sure, if you don't have a way to measure velocity, that you have to really rely on feel, which sometimes is a problem. But to be honest, the number 1 principle, and I don't know why I glossed over this, is a plan. Just make sure you have a plan. I think a lot of people just they overlook the fact of, hey, I'm going to go out and throw today. I'm not sure what I'm going to do. You know what I mean? But if you have at least a general layout of, and it doesn't have to be crazy complicated, it just needs to have a plan. So if you know that, okay, tomorrow's a high intent day, the next day's a low intent day, the next day's a moderate intent day, then you've got a plan. I think that's probably principle number 1. So there you go, Devin. I'm changing my principles right now. number one, have a plan. If you don't have a plan, I don't think it's going to go very well for you. You're going to probably either underthrow or overthrow. So number one, have a plan. Okay. Number two, go off a feel. How does the arm feel? Make sure that's a key indicator for all throwing programs, is let the athlete kind of tell him or herself or you what's going on, and compare that to the plan and make a good choice that way. 3, have a way to measure intensity. And then 4, use distance if you have to. So I hope that answers your question, Devin. That's good. It's a good question. Something I answer all the time, especially now when it's 30 degrees outside and we've got snow out there. So anyways, let's move on. All right. Our next question comes from Kayla. Kayla says, which would you choose? Kayla, if you listen to the last podcast, you'll know that I don't like which one should I choose. And I can tell you right now, the answer is going to be both. Guaranteed. It's going to be both right here. Okay. It says, if you had to choose, would you use bands or free weights / dumbbells for your arm care programming? Both. Kayla, this is a great question. So I tell everybody at this point, bands are cheap, dumbbells are cheap. There's no reason you shouldn't use both. But if you pinned me down and you made me say it, well, here, I'll tell you how we do it here. We actually have 4 days of arm care, 4 different types of arm care that we do here with our athletes here at Athletic Potential. There's a free weight day. There's a band day. There's an isometric day, and there's a ballistic day. We do a day where they move really fast. That's the ballistic day. I always tell my athletes, if you are going to miss one of those 4 days, which I highly suggest they don't, you miss the band day. The bands have not been that influential in what I think we are trying to build with arm care. I feel like they're helpful. I feel like they can do the job when needed. They're very easy to have logistically. You can take them anywhere. They're easy to set up. There's fences everywhere. You can attach them that way. Bands, I mean, I've given the colleges here that I've worked with band routines to do because that's what they have, and they've gotten a ton of benefit. So bands are great. But I tell everybody, look, free weights are probably my number one if you made me choose. But I probably wouldn't say that because I really like ballistics. I really like the idea of making these muscles contract fast. And then I like the isometrics for endurance. And then I like bands just to make sure that we're getting enough workload. So, Kayla, I hope that answers your question. I told you it would be both. It's actually 4 different. But yeah, I think everyone has its purpose. Everyone can help. Yet I don't see the reason why we shouldn't just do them all. And they all kind of target something different, which is something I like. So anyways, good question. So, all right. That's all the questions we have for this episode. I appreciate everybody that does ask questions. They're fun to answer. I really don't mind answering the same question over and over, as I feel like the more repetitive we can get sometimes, the more it'll get out there. If you do have questions for the podcast, again, just go to the website, click the link in whatever you're listening your podcast in. There should be a link that says ask a question. Go there, ask a question. If you have friends, family members, coaches, whatever, refer the podcast to them so that maybe we can get some more information out there and they can ask some more questions and we can kind of keep this going. I appreciate everybody's support of the podcast. I really have a good time doing them. It's fun. It makes me think. Makes me kind of challenge the way I do things, make sure we're not becoming complacent, which is actually one of the reasons I started this podcast, was to make sure that we kept thinking and trying to improve and developing. And so I really appreciate everybody contributing to the podcast in that way. And until next time, thanks. Hey everybody, I just want to say thank you for listening to the Athletic Potential Podcast. If you do have questions for the podcast, please visit the website www.athletic-potential.com/podcast. You'll find a button there to ask your question. Please input your information and your question, and we will answer any and all questions we get. And thank you again for listening. If you do get a chance, please rate and review the podcast. And until next time, thanks.